Welcome back to Anatomy and Physiology on Catalyst University. My name is Kevin Tokoph. Please make sure to like this video and subscribe to my channel for future videos and notifications. This video is going to be an introduction to the knee joint. Now, it's important to really have a firm grasp of what the knee joint is because it gets really complicated really fast. So I have this point here that's important to understand. It's a more complicated joint than you've probably learned. Depending on the courses you've taken, if you just took a simple undergrad anatomy and physiology, they probably classified the knee joint as a hinge joint. This is not correct. The knee joint is not a hinge joint. If you are looking at the knee with an untrained eye, just watching someone bend their knee, you might think it's a hinge joint. It's understandable. Really, all you can see are flexion and extension, but there's actually a little bit of rotation in there as well. So that's just one aspect of the knee that makes it a little more complicated. It's not just a hinge joint. We'll talk about why that is. And then we'll talk about the rotational aspects in a later video. But the knee joint itself is composed of three parts. First of all, there is a tibiofemoral joint. This is literally the synovial joint between the tibia and the femur. We'll come back and talk about this extensively. There's also a second joint here that we often forget about. It's the patellofemoral joint, a joint between the femur and the patella, and then you also see the patella also attaches to the tibia as well. We're going to come back in a later video and really dissect the patellofemoral joint. It turns out that it's a lot more important than you realize. And then third, there's a very, very, very strong fibrous capsule. Even with that strong fibrous capsule, the knee is still susceptible to injury and pain. So let's go through this one step at a time. Number one, the tibiofemoral joint. Well, it's just a joint between the tibia and the femur. End of story. All right, end of video. No, it's much more complicated than that. Yes, it's between the tibia and the femur, but it's a synovial joint functioning mostly as a hinge joint. Plus, it does have a small amount of rotation. Now, when you think of a hinge joint, you really should be thinking of, for example, the interphalangeal joints of the fingers. You should be thinking of the elbow joint. That's probably the first one that came to your mind. That's a true hinge joint. Okay, if you actually look at the structure of the elbow joint, you have that olecranon fossa and the olecranon that's going in and out of it as you flex and extend the elbow joint. That's a true hinge. If you look at the femur and the tibia, what are the two articulating surfaces? Well, you have the femoral condyles, both medial and lateral, and you have the tibial condyles, both medial and lateral. I've got two condyles, or two sets of condyles interacting. Wouldn't that make this a condyloid joint? And you'd be right. Technically, and most sources will not classify it this way. If you do a Google search, you will seldom find this. The knee joint is a condyloid joint. Okay, it's a condyloid joint with limited rotation. So sometimes what we say is it's a modified condyloid joint. It's modified in the sense that the other movements that you would normally have at a condyloid joint are extraordinarily limited. And they're limited by structures associated with this strong fibrous capsule, ligaments, and all that stuff. So other movements are extraordinarily limited. And so because you're limiting those, when you observe the movement of the knee joint, it appears to be a hinge. And so we say it's a modified condyloid joint. Some people will call it a modified hinge joint, but it is not a hinge joint because you have two sets of condyles that are articulating. Now, when we look at those condyles, here's the femoral condyles and here's the tibial ones. The tibial condyles are concave. Okay, they have some depth. Okay. And it's depth to allow the convex femoral condyles to sit in that concavity. Okay, so the tibial condyles are concave, and the femoral condyles are convex. Now, we'll cover this more in a future video, but these concavities of the tibial condyles are actually pretty shallow. And so we have to have these menisci, lateral and medial menisci, to increase the depth of those concavities so that the femur can have at least a decent attachment there. Okay. Now it's important to also realize that at the tibiofemoral joint, the articular surfaces of the femur are larger than the surfaces for the tibia. In other words, the femoral condyles are much bigger than the tibial condyles. And so for that reason, the femur is going to actually have to slide on the tibia to maintain good contact. Okay, and this is going to allow some interesting movements, which we're going to see a little bit later. All right, so that's the tibiofemoral joint between the tibia and the femur. But you can start to see and appreciate that it's a lot more complicated than that. What I also want to point out here is that unlike the elbow joint, where the humerus articulates with both the radius and the ulna, you don't see a fibulofemoral joint, do you? That's because the fibula does not articulate with the femur. Okay, the fibula is not involved in the knee joint. Now there are some ligaments like the LCL, the lateral collateral ligament, that do attach on the fibula, but the fibula itself does not directly articulate with the femur. So the fibula is not technically a part of the knee joint, okay? Just the tibia. Hopefully that makes sense. Now for the second one, and we'll come back and dissect this even more in a following video. It's actually really interesting. Patellofemoral joint. This is a joint between the femur and this sesamoid bone called the patella. In fact, the patella is the largest sesamoid bone in the entire human body. Now, this terminology right here, quadriceps tendon, patellar ligament, patellar tendon, all of those terms are extremely misused. Okay? So first, let's look at the anatomy here. Here's the patella. The patella is anterior to the distal femur. You can see that right here. This red structure right here is called the quadriceps tendon. To be rigorous, we'd say quadriceps femoris tendon. And technically, all four of the quadriceps muscles actually insert on this tendon. Okay? This is a true tendon because it connects a muscle or muscles to a bone. Tendons, by definition, must connect a muscle to a bone. And so this right here, the quadriceps tendon, does in fact connect the quadriceps, a muscle, to the patella, a bone. Now, you'll also hear the term patellar tendon, which sometimes people refer to as this ligament down here. That is not correct, even though it is very commonly used. To be very rigorous and correct, the quadriceps tendon up here in red is synonymous with patellar tendon. In fact, I can go ahead and add that in just so we have it here. This is equal to patellar tendon. Okay, the patellar ligament is not the same thing. Patellar ligament is not the same thing because by definition a ligament connects bone to bone. Tendons connect muscle to bone. So this is the quadriceps tendon or patellar tendon. I think we've beaten that to death. Now this green structure right here, this is the patellar ligament. It connects the patella right here down to the tibial tuberosity, which is of course part of the tibia. So does that connect bone to bone? Yes, it connects the patella, a sesamoid bone, to the tibial tuberosity. Now sometimes you'll see this termed the patellar tendon. That is not correct. This is the patellar ligament. Sometimes in courses you'll actually hear about the patellar reflex, where you strike the patellar tendon, right? This is actually where you're hitting with the reflex hammer, and then of course you know your leg shoots up, right? You go into knee extension. It's a reflex. You're not hitting the patellar tendon, okay? To hit the patellar tendon, you'd have to hit on the thigh, because the patellar tendon's up here. You're actually hitting the patellar ligament, which then causes a stretch of some structures, which we'll see later on, in the patellar tendon. But I just want to reiterate that and be very clear. This is the patellar tendon in red. This is the patellar ligament in green. So hopefully that makes sense. Now, as you know, as you go from flexion of the knee to extension and back and forth, you know that the patella slides up and down. For example, when the quadriceps contract, obviously they pull on this tendon and the patella moves proximally, or at least in this picture it moves up. When you go into flexion, again, the quadriceps tendon relaxes and the patella is allowed to translate distally, or in this picture, down. So what really is the purpose of the patella? It's just this little bone that sticks there, right? It can't be that important. Well, it turns out it is extremely important, and we're going to look at the physics of it in the following video, and you'll really get an appreciation of the patella there. The gist of this right now is that the patella increases the leverage that the quadriceps tendon can exert on the femur by increasing the angle at which it pulls on the tibia. That's a fancy way of saying that if you didn't have the patella, the amount of force the quadriceps would be able to exert on the tibia would actually be very low. Whatever you can currently do on the knee extension machine at the gym, or however much you can squat, basically take that amount and slash it to about 1/10 of that value. Okay? Basically what the patella does is it allows this ligament right here to, instead of inserting directly horizontally on the tibia, it allows it to insert at an angle. And you can kind of start thinking of your trigonometry there. Okay, by inserting at an angle, it's able to increase the amount of torque at the knee joint that's produced by the femur. Okay, the basic idea, if you didn't have the patella, the amount of force you'd be able to generate by the quads at the tibia would be really, really low. The patella allows more force generation at the knee joint by the quadriceps, and so more torque is able to be produced. You would not be able to squat the amount you're squatting right now if your patella was absent. Okay? You need a patella, and you might even have some issues walking. Okay? Now, the patella itself is stabilized by the insertion of the horizontal fibers of vastus medialis. So it turns out that the patella actually naturally has a tendency to translate laterally. It kind of just would continue to move, and we don't want that. And so the vastus medialis, at least its horizontal fibers near the knee joint, they actually allow something called patellar tracking. So they naturally are going to have a little bit of tone in them that's going to allow the patella to be stabilized in position when you're not moving, so that it doesn't actually move laterally. So stabilizing it in position. The patella is also stabilized by the prominence of the lateral femoral condyle, which discourages even further lateral translocation during flexion. So if you go into knee flexion, again, the tendency would be for the patella to translate laterally. But not only does the vastus medialis exert some pull on it to prevent it from going too far laterally, but the prominence of that lateral femoral condyle also prevents it, gets in there and gets in the way of it going too far laterally. And then also retinacular fibers, so that's some dense connective tissue around the patella, are also going to stabilize it during exercise. So the patella is very important, but actually if you just sit with your knee extended completely, just sit down, have your knee extended on the couch, you can move your patella around. You can actually grab it and kind of move it. It's kind of weird. You can gross some people out that way. And that's even with these three things right here. So they're necessary to stabilize that patella. And so the gist here is if you lost these three things, the patella would become extremely unstable, and the amount of force you'd be able to generate there at the knee joint through extension would be negligible. Now, the strong fibrous capsule we'll be covering in later videos, but hopefully this video gave you a good understanding. Please make sure to like this video and subscribe to my channel for future videos and notifications. Thank you.